Would a sugar pill ever cure your headache? Would a fake surgery actually make your knee stop hurting? It sounds impossible, and yet doctors have watched it happen again and again in patients who had no idea they were being tricked. Today, I want to talk about one of the strangest, most misunderstood phenomena in all of medicine and psychology, the placebo effect. By the end of this video, you're going to understand why your brain can sometimes heal your body just by believing it will, and why that fact makes an entire branch of science genuinely nervous. So, what exactly is the placebo effect? In the simplest terms, it's when a person experiences a real improvement in their symptoms after receiving a treatment that has no actual medical value, no active ingredient, no real procedure. Just belief. The word placebo actually comes from Latin, meaning I shall please, and for centuries, doctors used the term almost as an insult, a fake remedy given to patients who couldn't be helped any other way. But somewhere along the line, researchers noticed something strange. These fake treatments weren't just making people feel better emotionally. In some cases, they were producing measurable physical changes. Let's talk about how researchers actually study this. In a typical clinical drug trial, patients are split into two groups. One group receives the real medication, the other group receives a placebo, usually a sugar pill or a saline injection, something completely inert. Neither group knows which one they got, and when researchers compare the results, they expect the placebo group to show basically no improvement. But that's not always what happens. In some pain studies, placebo groups report improvements of up to 30%. In certain depression trials, placebo response rates have climbed as high as 40%, sometimes rivaling the actual drug being tested. Think about that for a second. Nearly half the people in some of these studies felt genuinely better after taking something that did absolutely nothing. So why does this happen? Psychologists point to a few different mechanisms. The first is expectation. If you believe a treatment is going to work, your brain can actually begin producing real chemical responses, releasing dopamine and endorphins, your body's natural painkillers, simply because you expect relief is coming. The second is conditioning. If you've taken real medication in the past and felt better afterward, your brain learns to associate the act of taking a pill with feeling better, and that association can trigger a response even when the pill itself is fake. And the third, and maybe the most fascinating, is the power of ritual. The white coat, the clipboard, the careful explanation from a doctor, all of it signals to your nervous system that you are being cared for, and that signal alone can start a physiological chain reaction. But here's where things get uncomfortable. If a fake treatment can produce a real result, what does that mean for medical ethics? To test a drug properly, researchers sometimes have to give real patients, people who are actually sick, a treatment they know will do nothing. In some especially controversial studies, researchers have even performed fake surgeries. Patients were put under anesthesia, given incisions, stitched back up, and told they'd had the procedure, when in reality the surgeons never touched the area being treated. And in several of these studies, patients reported the same pain relief as the people who got the real surgery. It raises a deeply uncomfortable question. Is it ethical to deceive a suffering patient, even if that deception might genuinely help them? This isn't just a historical curiosity either. Placebo effects still shape modern medicine every single day. Pharmaceutical companies have to prove their drugs outperform a placebo before they can be approved, and some companies have actually struggled to get new drugs past this bar, not because the drug doesn't work, but because the placebo effect has been getting stronger over time, especially in pain and depression trials conducted in the United States. Researchers still aren't entirely sure why. So the next time you take a pill and start to feel better before it could have possibly kicked in, or you visit a doctor and feel calmer the moment they start talking, you're witnessing your own mind doing something science still can't fully explain. Your body listening to your beliefs, and occasionally, your beliefs are enough to change the outcome.
I really hope you found this as strange and fascinating as I did. If you want more videos exploring the weird edges of psychology and the human mind, let me know in the comments, and I'll see you in the next one.